afternoon, and thank you for joining the Superior Health Quality Alliance Roundtable conversation around the COVID-19 vaccine and immune response. My name is Elena Baer, and I'm joined by my colleagues Jerry Hineker and Julie Campbell, as well as our guest speaker today, Dr. Buffy. Dr. Buffy is one of the foremost authorities on infection prevention and control in nursing homes and long-term care facilities. Her passion, her heart, her expertise, and her sincere desire is to ensure that all are equipped to provide the best care for our most vulnerable populations. She is a frequent contributor and interview source for national and trade press concerning infection prevention and control and mitigation. And she was on with us about last month sometime for a call as well. For those of you who have been joining these meetings for some time, welcome back. Those who are new to the call, we are so glad you're here. We host this session each week where we have about half-hour education session where we highlight important topics related to COVID-19. And then we have about a half an hour open office hour session. We hope you're able to join us each week. And one thing I would ask is that you think about any pebbles in your shoe or things you're struggling with or trying to figure out. If you can send me a direct message in the Zoom chat, we can add that as a topic for a future session. There will be a survey at the end of the session, which we would ask that you take a few minutes to complete. If this is helpful, we want to know, and we especially want to know if it isn't. You can find the link for the PowerPoint presentation in the chat, and please use the chat box to share any comments, questions, or anything else that pops into your mind during the presentation, and we'll use that for a discussion with the time that remains. With that, welcome, Dr. Buffy. The floor is yours.
Thanks, Elena. So happy to be here today. Glad you guys were able to take time out of your busy schedule to join today. And I'm super excited to be able to present to you today on environmental services. It's not the most frequently talked about area of infection prevention and control, but really truly a passion of mine, given the gaps in practices I see, and probably how we can implement solutions so easily without costing any extra money. So if any of you are like me, we try to save the dollars anywhere we can in implementing best practices. So this is definitely one of those areas. So today we're going to review the current environmental services practices in long-term care. We're going to explore some common challenges that I observe frequently related to how our facilities are cleaned and disinfected, and really identifying the proper process, as well as just some really great tips that you can be able to share with your housekeepers and environmental service staff. I want to say that environmental sanitation is an absolute integral part of providing a safe and sanitary environment. Many times we see our housekeepers, they're kind of in the background. They're doing their job. We're assuming they're doing it right. We don't really pay a whole lot of attention to what they're doing. And they're sometimes a forgotten group of individuals in our long-term care facilities, and yet they're so critical to ensuring that we have a safe and sanitary environment. I like to tell our housekeepers that without them, our buildings would close, because if we don't have this sanitary environment, we can't operate. So they're truly critical to the importance of our infection prevention and control program. There's practices such as the cleaning, disinfecting, and the proper storage of equipment that really do help prevent the transmission of potential pathogens. And the EVS team, our housekeepers, our maintenance workers, they're truly on the front line to support reducing the spread or reducing the risk of the transmission of pathogens within our healthcare setting. And unfortunately, if we have improper cleaning practices, this can lead to the spread of healthcare associated infections. We know, for example, C. diff, Clostridioides difficile infection, the spores can actually live on a surface for up to 5 months. And some new research is actually showing that these spores can live indefinitely on our surfaces. So you can imagine if we don't have the actual proper practices in place to prevent spreading those spores, how easily they can cross-contaminate the environment and they could infect a resident or even a healthcare worker. So I want to remind everyone really about why we're here, what we're doing. I want to remind you, I want you to imagine like how you felt when you first got into healthcare. And I just want to talk a little bit about the problem with our infections in long-term care. None of us signed up to be healthcare providers or working in healthcare. None of us signed up for the potential of creating harm, right? Of spreading infections. And what I want to remind you, and I did last time as well, is the problem of infections in our long-term care healthcare setting. We've all been through this global pandemic and have seen what's happened with COVID. But I want to remind you that the spread of infections, and especially within long-term care, has been a problem. In fact, 1 to 3 million infections are occurring in our long-term care environments every year. This is leading to 380,000 deaths, which is over 1,000 deaths daily. And if we really think about that, it's showing, environmental services, this is an area that can greatly reduce these numbers. Infections are the most frequent cause of transfers and hospital readmissions that lead to 150,000 hospitalizations. They cost an additional $673 million in additional healthcare costs. So this is all a really big problem, right? And I bring us back to this to remind us of our why we're doing what we're doing, why infection prevention and control is so important. You'll hear me frequently lean heavily towards the prevention piece because we want to prevent them. Now, I show you these statistics and they're heavy. And what if I were to tell you that they're preventable? The research actually demonstrates up to 40 to 50% of infections are preventable. And one of the best ways that we can do that, apart from our clinical, is within our environment of care. And so today we're going to take this journey and dive a little bit deeper into this and talk about some of these best practices. So first I want to talk about cleaning versus disinfection. Many times we're referring, we don't really think about the difference. The cleaning, they're used together, but they are different. So cleaning is the actual physical removal of any dirt or bodily fluids or any other organic matter on a surface. The actual disinfection process will destroy a number of pathogens on a surface. Now, many of our products are actually a one-step process. You'll see like many of our cleaning agents, they're a cleaning and disinfectant. But what's important to know is, especially if you're using these products, and I saw this a lot during the pandemic, is some of the cleaning agents that we have, you can spray them and leave them to dry and you don't have to actually touch the surface. But just keep in mind, we're not actually cleaning the surface if we're only doing that step. We're actually disinfecting. So it's important that we actually have a process to physically remove any of potential pathogens on those surfaces. And that's the cleaning part. And we do that with different products and different protocols. So I posed this question last time to you. How clean is your environment? We look at our trolley carts. We want to make sure that our housekeepers, our EVS staff are protected, as well as our residents. So first we want to look at the actual cleaning cart. You see here this picture, and this is an actual picture of a facility I was at. You see the toilet bowl brush next to eye protection. Like, how safe is this for our worker, right? I mean, I wouldn't want my eye protection right next to the dirty toilet bowl brush. So we want to make sure our trolley carts are well organized and we're not going to cross-contaminate our environment within that. So I asked last time, is it a common practice for you to clean your bathroom first? And most of us will say, no way, doesn't happen. But it does happen. It happens a lot in our healthcare facilities. And this is something we can easily fix today, and it doesn't cost any money. It does cost time because we need to train. But about 50% of the nursing homes I go into, and when I'm chatting with the housekeepers, I ask them, what's your process for cleaning the room? And they'll tell me, well, I start in the bathroom first, then I go into the resident room. And even though they may be changing the towels or the rags they're using, they don't necessarily change their gloves. So the potential for cross-contamination is high. So this is a simple question that you could even ask today with your cleaning staff. What is your process? And really, I really understand this because this can go a long ways in preventing cross-contamination. So we want to make sure that we're actually cleaning the resident room first. The order truly does matter. We want to clean from the cleanest to the dirtiest to the highest to lowest in a clockwise or counterclockwise manner. For example, we can empty the trash, the horizontal, vertical surfaces, and then sweep and mop the floors. The next is the restroom, always last. Stocking supplies, emptying the trash, the sink and tub, the surfaces, and clean the toilet and sweep and mop the floors. One of the things I do ask our housekeepers too is how often they're changing their gloves. And if they tell me they're changing their gloves right immediately after they're done with the room, we have to think about the opportunities that those gloves, contaminated gloves, are then touching other areas. So for example, if we're cleaning the restroom last, and then we're going and grabbing like the mops or other items on our trolley cart, we could be contaminating those items with our dirty gloves. So we always want to provide guidance. We want to clean the cleanest to the dirtiest. After any dirty, and I put that in quotes because, you know, dirtier areas, we want to make sure that our staff are changing their gloves, using hand sanitizer, and then putting on a fresh pair of gloves. I do like having hand sanitizer on the cart itself because that is a reminder, a visual cue for our housekeepers in being sure to conduct hand hygiene. So it's really important we talk about our shower rooms. This is probably one of the biggest areas that I have a pet peeve with because first of all, we're moving constantly so fast in our rooms that this is one of those areas that just doesn't get cleaned appropriately. Many times I see clean towels stored in there. We don't want to store clean towels in our shower rooms unless they're well covered. We want to make sure that we're using appropriate products. And you'll see here these mats, the chairs, the shower chairs that have the pads. If these ever get ripped or torn, we want to make sure we throw them out because they can harbor bacteria. Our shower rooms are very opportunistic for harboring and growing bacteria. They're a moist environment. I often will smell mold or see mold in the shower rooms. We want to use a spray. You know, we talked about the disinfectant. I like to spray down the shower room with the spray because it really helps get the entire surface clean after each resident. We talked about the trolley cart. We want to make sure that it's well organized, it's cleaned. We have a bag for the dirty laundry or the dirty trash. We have a bag or an area for clean towels. We want to, you see here this picture, we don't want to store food or drinks on our trolley carts. We want to make sure we have the supplies we need. So the towels, the rags and towels and the cleaning agents as well. And then here's that same image. We just want to make sure we're not cross-contaminating any of our equipment. So when we talk about different methods for cleaning and disinfecting, so right here on this left-hand side, microfiber mop or microfiber towels, it is a recommended practice to actually soak them in your buckets. I'm curious in the chat, and you can just put in yes or no, if this is a practice that you are doing right now, if you know that your housekeeping staff actually soak the towels in the bucket. So just, you can put a yes or no in the chat, just if that's a practice you guys actually implement within your facility. The reason we want to do that is you're essentially creating your own Sani wipe. That way you're not spraying it because then maybe you don't know how much you're getting on the towel. And then on the surface, you don't have to wait for it to meet a certain criteria or a contact time. By having them soaking in the cleaning agent, then you're able to basically wipe it down, you're cleaning it, you're disinfecting the surface, and then you can leave it. So that's a really great practice. I see Wendy said she's doing that. That's awesome. You do want to check with the instructions, the manufacturer instructions for use for your cleaning agents. There are a select few that don't recommend this as a best practice, as it can create like just kind of a sticky residual. So you do want to verify with the product you're using that this is a recommendation. But for the most part, this is pretty widespread and really a best practice. Same goes for our mops. I do recommend using the microfiber mops if you can. You can see here in this picture, the bottom picture, you see the mop bucket. Like, this is so disgusting, you guys. We need to eventually get rid of this altogether. This is, you see how dirty this mop bucket is? This is not uncommon when I see these mop buckets. They're very difficult to clean. We have the rope mops that go in there. I mean, how comfortable would you feel if your floor was being cleaned with this type of process, right? So really, if you can eventually switch over to the microfiber mops, I highly recommend it. And you know, they are launderable, so it's something that you can reuse, and it's just so much more hygienic. So definitely consider that into the future. If you're up for budget and you can change those, it's just definitely a better process. Also, what's really important is to make sure that we have the supplies that we need. I want to tell you a brief story. I was on site in a facility in Detroit, and I was working with the housekeeper. This was in June of 2020 when I was working with the Doctors Without Borders team. And I was supporting the housekeeping staff. I was working one-on-one with them. And I remember chatting with the housekeeper that told me she had 2 rags for the entire hallway to clean. You see on the left hand, one of the white rags was one of the rags she had. I was able to bring in some microfiber towels for them eventually to support them, but she basically had 2 of these very small white rags. And you know, that's not effective in being able to clean an entire hallway. So I asked her, where can we get more? And she just kind of looked at me and she said, you know what? I just come in, I do my job, I put my head down, and I don't, you know, create trouble. And so I said to her, well, let's go get you some more rags. We need more rags. And so we went down into the laundry room. We took some of the towels off of this table, and we basically got yelled at, the laundry attendant, you know, saying, you know, these aren't for you. You can go over to that barrel over there and cut up some more. And so she kind of looked at me, she says, see, Dr. Buffy, this is why I don't ask for anything. The bottom line is, I went and talked to her administrator, and he was like, of course we can get her more towels and rags. Like, that's no problem. But she just wasn't empowered to speak up for herself. Her supervisor was really blocking her and preventing her from getting the tools that she needed. On the right-hand side of this, this was also a similar picture, but another housekeeper in that facility was using paper towels. And so we want to make sure our staff have what they need and that they're empowered and equipped to ask for what they need. I've been in facilities where they're using water to wash the floors because they don't have any solution left. That's something that happened over the weekend once. And so we just want to make sure that they're empowered to speak up and to be able to get the supplies that they need. I want to remind you that we always, always, always need to follow our manufacturer instructions for use when it comes to our cleaning agents, whether that's a spray bottle or a sandy wipe, or if we are soaking them in the cleaning agent. This is really true for any of the way, any type of cleaning agent or equipment. This is like, if there's one thing you can remember, it's we need to train our staff in following these IFUs. It's very important because the way that these cleaning agents meet EPA registration and they're actually designed as effective is by meeting rigorous standards. And so we need to follow these standards in order to effectively kill any contaminants on our surfaces. So we're all very familiar with contact time and dwell time and how long the chemical needs to stay on the surface. One of the things you can do is even perhaps write that with a Sharpie on the bottle itself. It helps remind the staff, especially if they're being quizzed by a surveyor. That's nice to have handy. But again, just making sure we follow those instructions for use. We also want to verify that our cleaning agents are EPA registered and effective against COVID. This is one of our federal requirements since COVID came into place. I cannot tell you how many facilities I've been into that tell me our vendor provides our cleaning agents, and they wouldn't provide us anything that wasn't approved by EPA or on the end list. And I'm here to tell you that's not true. So when we go on site, we actually will verify, we look up the EPA registration number, and then we look up on the end list to make sure that it's on this, the effective against COVID. If your cleaning agent does not have an EPA registration number, there is no way to check to see if it's effective against COVID. So first and foremost, our cleaning and disinfectant agents, they must have an EPA registration number. That is a federal requirement for our long-term care facilities. So that's the first step. Verify it's EPA registered. If it's not EPA registered, then you need to go back to your vendor and let them know we have to have cleaning agents that are EPA registered and effective against COVID. Now, for different infectious diseases, you want to look up to make sure they're effective, such as C. diff and norovirus. So for example, this is an actual, the K list actually helps. Sorry, my image is wrong, but the information is right. We want to make sure the EPA K list is actually helps us determine if a product is effective against C. diff and norovirus. So they're different. And there's different lists that help us to determine the effectiveness. Not all of these cleaning agents are approved to kill these infectious diseases. So we want to verify that what we're using is effective. You know, when I talked about C. diff, the spores can live on the surface for 5 months. If we're not using an appropriate cleaning agent to kill that spore, then we can potentially be spreading that to our residents and our staff. So this is really important to make sure that we are using the products that are effectively killing these infectious diseases. Here's a couple checklists. Definitely like using checklists. Consider maybe even laminating these and having your housekeepers utilize these. What's really important is making sure too that the staff are cleaning in the order that is going to decrease the risk for any cross contamination. Like we talked about, cleaning from the highest to the highest to the lowest and the cleanest from the dirtiest to the dirtiest. We want to ensure that our staff really understand that. Even if they're trained that way in their orientation, or if that's your policy, that does not mean that's the way they're cleaning. Many times they'll fall back on old ways that they learned. Ask your staff why, if they do clean from the dirtiest to the cleanest, why is it that you clean in that order? They'll tell you all sorts of reasons. Perhaps they're working their way from the back of the room forward. Maybe that's the way they were taught from their mom or their dad. There's just different reasons why we do different things. And so we want to make sure everybody's on the same page. So I like checklists, can modify them and utilize them as is helpful to your facility. So here's some great training videos. You will have access to the slides. I love, 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 love these videos. I recommend them everywhere I go. The Oregon Patient Safety Commission created these videos in 2016. They're in English and Spanish, which can be very helpful. But what I love about them is they're fun, they're cartoonish, they're like 8 to 10 minutes long, and they really, as you see the topics here, best practices for cleaning, disinfecting rooms, norovirus, it's actually Clostridioides difficile infection. They changed that name a few years ago, so it makes it hard for everybody. But these training videos really help connect the why to our environmental cleaning staff, our environmental service staff, and help them understand their critical role in preventing infections. So I highly recommend using these videos as part of your training. I would have all of your staff, and I know we're not talking about it today, but they also have some videos on laundry and food service as well, and some other videos. So definitely highly encourage you utilizing these resources. I want to talk about carpeting really quick because many of the facilities, especially in some of the Midwestern states that I continue to go to, still have carpet. It would be a happy day for me if I can walk into a facility and there is no carpet in our hallways and in our resident rooms. And I understand the reasoning behind it. A lot of it is just for that home-like environment, but carpet really can harbor our microorganisms. They've been proven to, when you're vacuuming them or cleaning them, they can disperse aerosols into the air. And so we definitely need to practice and evaluate how we're cleaning our carpets. The vacuum cleaners, take a look at your vacuum cleaner. When we go on site, we actually look at the vacuum cleaners and just make sure that it's equipped with a HEPA filter. That will help reduce the risk of the aerosols being generated into the air, and as well as just the equipment that you're utilizing. If it's really old and dust comes out of it, we definitely want to work on replacing those carpet cleaners. Let's see. So just talking about, we said some of these carpet cleaners, they can harbor the microorganisms and contaminants. They can serve as a reservoir, especially like the wet cleaners, as they can become contaminated with these waterborne organisms. So we want to make sure that they're actually being serviced according to their instructions for use, the manufacturer instructions for use, so that we're not potentially contaminating our environment with these cleaners. And then also just making sure that, like I said, the equipment's kept in good repair, and that that it's allowed to dry, especially the wet cleaners, that they're allowed to dry in between use. So with that, we definitely went through kind of quickly, but we talked about some of the tips that you can implement within your environment. Just a couple more things before we go into questions. I want to talk about the storage. We want to make sure that we're storing our cleaning equipment in a safe and an appropriate manner. We want to make sure that our chemicals are put up and safe, and that our trolley carts are really well organized and cleaned before they're stored. This is really important so that the next time we use it, we're not potentially cross-contaminating our environment as well. So with that, we'll go into questions. I do want to just let you know, again, my book Broken is out and it is available for purchase. It describes the global pandemic and what we as long-term care have had to go through. And there's some great examples actually in here from the environment. You'll see that I spend a lot of time with the housekeepers and the importance of housekeeping. So with that, I'll turn it over to you guys for any questions. I'd love to hear feedback, see if how else I can support you with your environmental services.
Thank you so much, Dr. Buffy, and we really appreciate that presentation. I know I especially really loved your sentiment about empowering all of your staff, right? Not just your environmental services team, but everyone. But yes, thank you so much for providing this presentation. And I see there's already a question in the chat asking about those cleaning checklists.
Yeah, so I was noticing that as I was going through, I didn't see the link to that. So I will definitely get the link. Who I can get it to the Superior Health team, and then we can get it out to the distribution list. Or yeah, I think would that be the best way we can do that?
Yes, definitely.
Okay.
We can send that out in an email. And I know we're also having a little bit of technical difficulty with getting our PDF of all the
Okay.
slides into the chat here. It was not working properly. So we will probably be sending that out after as well, unless we're able to kind of work in the background here during this call. We'll try everything we can, but we'll make sure that everyone has access to the slides after the call, if not during. So
Yeah, and I just want to say too about the checklist. So, I'm not naive to the fact that we're all struggling right now with staffing, and we want to make sure that our housekeeping practices are being done effectively. So I really encourage you, even with the ones that I provide, keep it really simple. Even if you just have a few items on your checklist as far as the order they're cleaning, or there's another one actually I'll provide to you to share with the group that I actually created that has kind of a step list that actually kind of makes sure that we're going through the right order as well. So I'll provide that as well, and you can change it. It's just a one sheet, has some pictures on it, but I'll be sure to share that. We just got to keep it really simple and easy, so that our staff don't feel overwhelmed and they're able to implement these best practices the best way that they can.
great, thank you. And just as a reminder, you are welcome to also unmute yourself to ask any questions that you might have. I know sometimes you have a detailed question and it's difficult to type out. So please feel free to unmute yourself or add any questions into the chat.
Absolutely. So we'll go ahead and move into the second part of this call now, which is kind of some open discussion just amongst everyone who's on the call today. So again, feel free to keep those questions for Dr. Buffy coming in chat. Go ahead and unmute and ask. But while we have the benefit of Dr. Buffy being here and also all of your peers as nursing home leadership, wanted to get some discussion going around what your biggest challenges have been kind of navigating these environmental services and facility cleaning topics. So biggest challenges, what's on your mind? What are you kind of struggling with around the environmental services topic? Feel free to drop it in chat. You can unmute. If you're having any trouble with the mute button, you can also raise your hand and we'll go ahead and unmute you.
And Julie, is it okay if I add something?
Absolutely.
So this is, we could talk about this for a long time, but I really want to stress the importance, and I know I already have, but of following the manufacturer instructions use. And I'm going to tell you an area that I see a common problem. So many facilities will actually have outside third-party agencies that are contracted for their environmental services. And if that's you today, I highly encourage you to identify what their practices are in regards to everything we talked about today, but making sure all their cleaning products are EPA registered. We didn't talk about this today because it's more in the laundering, but find out if you're using microfiber mops and towels. We want to make sure we're following the proper process for laundering them. And I'm going to tell you why. So our microfiber towels and mops are really, really an effective product. If just alone the microfibers can remove pathogens and remove bacteria from our surfaces up to 93% without even any cleaning agent. But the problem is if they're not laundered appropriately based on the heating temperature, the chemicals, and the drying, then those microfibers actually will hold on to the bacteria. And so if your facility that are using these products, please verify that your laundering process is meeting what the manufacturer recommendations are. There are some third-party contracted services that have a blanket policy for never ever drying the mops or some of the towels. And that could potentially be causing harm, because if the manufacturer recommends a low heat, then that's essential in order to remove the bacteria from these microfibers. So I bring that up because it's something that I battle when I'm in the field and I see that happening. We want to make sure we're following the proper instructions, because again, that's how the product was created. And that's going to ensure that our environment is the cleanest that it possibly can be.
Great point, Dr. Buffy. And that kind of speaks to another piece that happens kind of outside of the facility too, but all of these things really fit together. So I think that's a great point too. All right, and opening it up to the group again, any things that you are challenged with? It looks like we did have a chat come in. So my staff seems to struggle with when rooms need terminal cleaning. Residents are put on precautions for many reasons and sometimes resolved within a short amount of time. Is there a pre-made cheat sheet for staff?
Yeah, so one of the on the slides I provided was for terminal cleaning. The CDC actually, I actually obtained that from the CDC. It's a terminal cleaning checklist. And I recommend using this for all residents. And this way you're going to ensure that the rooms are properly cleaned and disinfected. If you know that a resident had some type of multi-drug resistant organism, then perhaps even making sure that, a bleach solution or other deep cleaning is occurring. But you could literally set that standard for all of your rooms, and that way you can ensure that everything is being cleaned and sanitized, disinfected the appropriate way. It's what I find easier is to set a standard for all of the rooms for the terminal cleaning. That way you're covering yourself and ensuring that that there are no pathogens that are being transferred to the next resident. You also want to be very allow for sufficient time for these terminal cleans, especially mattresses. If there's any rips in the mattresses, we want to make sure that that's being addressed, because they can harbor microorganisms. But we really need to make sure we have the proper time allocated for these deep cleans. I know in hospitals, this is a really big issue because those beds are turning fast. But we really don't want, a new resident coming in and contracting a healthcare associated infection based on from the resident before. So definitely spending time and making this a priority is really important. So we'll make sure that you get those links to those checklists. That can be very helpful as well.
Thanks, Dr. Buffy, and great question, Kayla. Any other questions, any challenges that your teams are facing?
I'm curious if we're actually doing any audits or evaluations of our housekeeping practices. I know that we're very good at doing, when we have orientation and our annual training, but what's going on during the year? We actually going up to our housekeepers and asking them, let me see the process for how you clean a room. Obviously in a non-threatening way, we just want to teach and we want to have a coaching and educational opportunity, but it's like just having them share that. What I also find is helpful is have them show you their process, because when they tell you their process, it can be very different than when they show you the process, and you can very clearly see potential areas of cross-contamination when you watch it versus just having them tell you. I've learned this from experience, because when I have somebody tell me their process, they walk me through the process. I think, okay, you're doing a good job, but then let me see it. And then I realize, oh, they're bringing maybe the toilet bowl brush in with them, setting it down, and then they're going into the resident room after handling that, so that you're able to see the different areas cross-contamination. And then I just recommend doing that on a frequent basis, so that you can evaluate those practices. Again, our housekeepers are frontline staff. They're in every single room, every single day. They're in all of those areas. And so if we don't have these practices in place, then it's hard to implement other practices.
I think that's a really good question. I know Elena put that in chat too. Is there anybody on the call who is auditing or evaluating their housekeeping services, kind of doing those walkthroughs? Feel free to, you can throw either a yes or a no in chat too. All right, looks like we do have a yes. And I think that kind of moves into another question for the group too. I know we've been talking about some challenges that you might be having, but any strategies at your facilities that are working really well. So I know Dr. Beth through those checklist resources, having standards in place, doing these kinds of walkthroughs, but is anybody else doing something that's really helped get everybody on the same page about this? Anything really creative, any training activities that are going on? Feel free to share. Not seeing too much come through in the chat yet. I guess Dr. Buffy, maybe I'll put that question to you, to any kind of creative things that you've heard of as far as training has gone.
Yeah, it does look like Tracy responded that monthly audits share results with the IPCO, who can follow through with EVS supervisor, immediate feedback during audit so that the team members understand. That's great. I think the more that we can provide that feedback to them, it's really important. When I first of all, I just think we in long-term care do not celebrate. Let me rephrase this. We are often, as an industry, very much not well supported. I'll just say that in general. And I'm all about celebrating. And I know in our facilities, we definitely celebrate our staff in many ways. And the housekeepers are very near and dear to my heart because, like I said earlier, they kind of tuck in and, they're not always the most visible. And boy, they are doing such a great job and care so much. Many of them take such good pride in they're caring for their, imagine that they're caring for their loved ones and doing this job. And so I think they want to do a good job. And so sometimes they just don't understand what that process is, or they don't understand some of these simple practices. So by conducting these audits and then being able to provide those results to them, I know for me personally, when I observe a housekeeper say, like, just show me your process, I'd love to learn. And then I start with the feedback of what they did well. And then I ask them, is it okay if I provide you some feedback? I ask their permission. And then when I tell them simple things like, we want to start from the cleanest to the dirtiest so we don't cross-contaminate, and I help them understand that and see that, it's often like, oh, I just didn't even think about that. Or the gloves, like when the staff tell me, oh, I changed my gloves only once after cleaning the room. And I'm like, well, can I imagine, like, you're cleaning the bathroom and then you're going and touching other things that you may be cross-contaminating. And so just putting it into simple terms is really helpful. And I just think the more coaching that we can provide, I agree, is very helpful to our housekeeping staff, and then empowering them maybe. So for example, I talk about microfiber mops, and I did have, and I encourage this, I did have a housekeeper tell me once that the particular floor that they had, it was some type of hardwood floor, but the microfiber mops were actually scratching it, or not, it just wasn't looking good. And so she used the rope mops to make the floors look good. And I was like, well, that makes total sense to me. So sometimes we want to understand why they're doing what they're doing too. And then of course, in that situation, I was like, well, make sure you're changing the water every 2 to 3 rooms, or if it's very dirty, just providing that coaching, because clearly in that situation, using the rope mops was best. And so, we have some general best practices, but then of course, every facility is unique, and what you're doing is unique. And so modifying what those practices are based on your unique circumstances is important too.
Those are really helpful examples. Absolutely. Thank you. Anyone else? I'll just pause really quickly. Any other strategies that are working really well? Okay, one more question. I'm kind of curious for all of our attendees joining today. We had talked about sometimes environment is in-house, sometimes it may be a third party. So how are you communicating with your environmental services team? Has that changed during the pandemic? Has it been something that's worked really well to keep that communication open and keep everyone updated? Any best practices that you are using that you'd like to share? While we're waiting for anybody to type in chat, looks like we do have the link to the PDF slide there. So feel free to click on those. That'll link you right to the resources that Dr. Buffy shared today.
So I love what Tracy said about the acknowledgement of the housekeepers. 100, I couldn't agree with you more. I absolutely agree with your statement that they are the ones that are bringing many of the concerns to the nurses, and they're just so important to the team. And then also that the leads attend the morning meetings. That's really important, because it is often in those morning meetings that you identify what residents are on transmission-based precautions. And that's an area I didn't talk about a lot, but ensuring that your housekeeping staff have that training on how to properly wear the PPE. Through the course of the pandemic, we have all become quite the experts at this, and our housekeeping staff definitely have that education as well. But we definitely want to make sure they are protected, as again, they are in every single room. And so I think those are great comments. I would encourage you. I've often heard comments of, with the housekeeping staff that may be contracted. It just depends on how involved, you are. But I've heard from facilities before, like, they have their own products, it seems more disjointed. And so, but knowing that you have the right, you're held to the federal standards. And so making sure that what products are being used, that they are EPA registered, and that their staff truly are trained in the best practices, and just making sure of that. And that's really important. And having that, that partnership together. So I just encourage that collaboration, of course.
Thank you. Yes. And thanks for all the comments in the chat, everyone. One last question that I kind of had, I know we have about 10 minutes left. what do you think is the most difficult area to keep clean within your facility? And then share with others on the call what kind of tips and tricks or little things that you've done that have made it a little bit easier. Maybe it is that mop bucket like Dr. Buffy was talking about, or maybe it's the shower room. What types of things or what place is it in your facility that you're always just like, oh my goodness, it is so difficult to just make sure that this is up to our standards at all points in time? And then what types of things have you put into place to kind of remedy some of that, mitigate some of the difficult parts of keeping every space as clean as we all want them to be? It's just kind of like your house. We're doing our very, very best. And especially when you have limited resources and maybe staff members aren't empowered to ask for the things that they need. What kinds of things have you done to mitigate some of those? So I'd love to see some spots and some comments. I know we all have them because I know we all have them even at our own homes. The pesky bathtub, maybe it is. Shared equipment such as the Hoyer lift. Yeah.
And we're going to talk about that in one of our upcoming sessions. Absolutely. Shared equipment is a big deal, and that falls more on our nursing staff. And so we're going to really dive into that and some best practices in one of our upcoming sessions, because I've definitely got some good tips for this practice. And, you know, some of the challenges, and Jamie, I appreciate that, you know, some of the challenges in our long-term care are infection control practices can be very challenging because we're in an environment that, you know, we have to, we're talking about life safety as well. And so the risk of harm to our residents, maybe from the equipment or the cleaning agents. And so I love these strategies, and they're definitely strategies that I see as well, but we'll dive a little bit deeper into these strategies because, you know, we can have these cleaning agents on this equipment, but it can also go against life safety. So it's like, what's the risk? We have to evaluate the risk of harm. And then some states will tag you if you do this. So it just, you know, not, I know Minnesota, Michigan, Wisconsin are good because I'm there all the time, and their surveyors are okay with this practice, but we'll talk a little bit about that in one of our upcoming sessions for sure, because definitely an area that is a challenge.
Well, what a great segue into our future session. I promise me and Trisha were not plugged for those responses. So thank you both for answering those. And you can continue to put things into the chat. One thing I do just want to mention, because Jerry just posted it in the chat, we value your input. You heard me mention at the top of the call that we would have an evaluation here at the end. If you could click on this link in the chat and take that evaluation and let us know how this call went and what type of topics you might want to hear about in the future, we'd really appreciate that. We all look those over and use those to guide what we do moving forward. But any other questions or comments? We have a few minutes left here, and we have such a knowledgeable speaker here with us today. Please feel free to, again, unmute yourself or put any questions or comments in the chat before we close out for the day. Give everyone a few, like 10 more seconds or so. All right. I'm not seeing any other than Tracy. Thank you for enjoying today's presentation. I know I did as well. I hope all of you did too. And we look forward to chatting with you again next week. And Dr. Buffy will be back with us again sometime next month. I don't have the date right in front of me right now, but we look forward to welcoming her back again next month and covering some more topics. So thank you, Dr. Buffy, and thank you everyone for participating today. We really, really appreciate it.